In mild eczema, steroids are usually not needed, but if very itchy and inflamed eczema, you can use Hydrocortisone 1% cream, which is available over the counter, and apply only to patches of eczema and not as a full body cream. Steroids have to be applied thinly, using a fingertip amount, which is roughly twice the size of an adult hand, applied twice daily and for 7 days, at which point you should see a doctor if there is no improvement. Steroids are definitely needed if moderate to severe eczema. In mild eczema, you have a few patches here and there, but in moderate to severe eczema, the patches are more pronounced and sometimes widespread, usually behind the knees, in the elbow, neck, trunk, legs, and sometimes face, including around the eyes. It's more obvious in light skin, as you can see red, angry looking scaly dry patches, while in darker skin it's not red but usually darker than the rest of the surrounding skin. Hydrocortisone 1% is not as effective in moderate to severe eczema, so the option would be more potent steroid creams such as Betnovate 0.1% or Elocon ointment. Ointments are preferable as they stay in for longer, but if you have sweaty, oily skin, then steroid cream will be a better option. Now, eczemas tend to get better with treatment, but they can flare up again for various reasons such as triggers, which could be change in weather, stress, diet, and other factors. So one option of treatment is called the weekender regimen. So let's look at how to apply steroids to affected areas only using the weekender regimen. Week 1, apply twice a day. Week 2, once a day, preferably evenings after a bath or shower. Week 3, on alternate days or every other day. Week 4, on weekends only. So basically, as the week progresses, you are gradually tapering off the steroids rather than using them every day for weeks or months and causing permanent skin damage. You're treating the eczema while helping to avoid and minimize any side effects such as bruising, thinning of the skin, and light patches. So if you're in week 3 and for whatever reason the eczema flares up again, then you can go back to week 2. This is the most effective way to use steroids, especially in chronic eczema or frequent flare-ups. Here is a very important note as to why steroids might not work. Some people apply both steroids and moisturizers together at the same time. This is not advised, as moisturizers act as a barrier preventing anything from getting through the skin, and that includes steroids. So if you have a flare-up, you should use the steroid first, then wait minimum 20 minutes before applying any moisturizers. Once the skin is much better, it does not matter which you apply first, moisturizer or steroid, as long as you wait 20 minutes to allow either one to soak into the skin. I hope this has been useful, and please subscribe to my channel as I'll be sharing more videos on eczema with the use of moisturizers, steroids and other alternative treatments in more detail.